Memorial Health System provides comprehensive health services that meet the needs of the region we serve, and we are proud to present Memorial Health Radio. Here's Melanie Cole.
Heart disease is the number one health problem in the Mid-Ohio Valley. One reason state-of-the-art cardiac care is critical. My guest today is Dr. Solomon Bagae. He's a cardiologist with Memorial Health System. Welcome to the show, Dr. Bagae. Let's start by telling us a little bit about yourself and what areas do you specialize in?
Okay, thank you for this opportunity. My name is Solomon Bagae, and I'm one of the cardiologists at the Memorial Health System. My background is I am trained in general cardiovascular diseases, and I'm currently specialized mainly treating general cardiology and congestive heart failure, or what's called heart failure. And currently I'm running the heart failure clinic at Memorial Health System.
What are you seeing, Dr. Bagae, as far as awareness and information about heart disease, stroke, congestive heart failure, any of these things? Do people, are they aware of these things and the risk factors involved?
Yeah, my general, assessment is the awareness is it's much lower than what my expectation is. Currently most of our population is not aware of the general expectation when to get the cardiovascular evaluation. What are the major symptoms and what are the major presentation? What can be done? Even the cardiovascular disease become clinically relevant. So, as far as I can say, this is there is a lot of missing information in this aspect of cardiovascular disease.
So let's clear some of that up today, Dr. Bagae. If someone sees their family physician as their annual well visit, when would they see a cardiologist for an initial checkup?
Okay, usually most of the main healthcare evaluations start from the primary provider or from their family physician, and based on their screening, if the person has what's called a high cardiovascular risk, or if the person has like a familial predisposition to cardiovascular disease, depending on the assessment of their family physician or primary care physician, selectively some of the population needs to be evaluated by cardiovascular specialist.
Tell us about some of the services your cardiology department offers.
We have a very comprehensive group of physicians, including PA, NPs, and cardiologists, and we provide pretty much most of the cardiovascular screening, diagnostic, and therapeutic evaluations. This includes general screening, preventive cardiovascular disease. We have a dedicated what's called heart failure clinic where we treat heart failure patients. We have general intervention cardiovascular labs to do what's called coronary stents and diagnostic procedures. And we have a dedicated what's called arrhythmia or electrophysiologic lab where we can study the electrophysiologic abnormalities or electrical rhythm problems of the heart. Pretty much we cover most of the cardiovascular diagnostic, screening, and therapeutic areas in Marietta Memorial Hospital.
If somebody was to ask you, what is the most important screening for heart disease that you would think, do you tell them a stress test or a coronary calcium scan or blood work? What screening do you feel is most important for people to know about?
The first entrance or the first screening method is assessing individual cardiovascular risk score by assessing their background in health, family history, their exposure to cardiovascular risking factors. The first and easiest way to do it will be the assessment of pretty much what's called a cardiovascular assessment, including checking the cholesterol level, blood pressure check, and there are like some modalities of blood test which we can screen. Then based on that test, then we will provide the next stage of what's called a cardiovascular screening, whether it includes an ultrasound or vascular study, or it might be calcium score, or it might be a stress test based on individual patient exposure for cardiovascular risk.
What prevention advice would you like to give the listeners so maybe they don't have to come see you?
That's a very good question. I think the most important thing is first being aware of what are the major cardiovascular risk factors. This includes high blood pressure, family history of a genetic predisposition to cardiovascular risk, diabetes, checking their cholesterol level, checking their family background and to make sure that there is no cardiovascular disease. And by knowing, aware of their risk, they can do a lot of intervention. That means by doing what's called a life modification. This includes watching what are the appropriate diet, exercise regimen, and some of pre-screening for cholesterol level and blood pressure and preventing that from happening.
Tell us what's going on in the field of cardiology. What's exciting?
What's exciting is cardiovascular area is the most researched area in medicine, and there are so many new upcoming breakthroughs in cardiovascular diseases. It's not just like from the premature screening of the cardiovascular problems to advanced therapy once the patient develops already heart failure. There are new breakthrough like in genetic testing, how that is going to be applied in medicine, to the advanced disease where at the time where the person is already in advanced cardiovascular disease, to take care of them with advanced therapies like transplant and mechanical assist device. So there are a lot of development in cardiology.
What would you like to tell the listeners as the most important bit of information that you would like them to know about heart disease and the cardiovascular services offered at Memorial Health System?
I think my biggest advice will be for the person to be aware there is no young or old person to get screened. And if we get screened early and if we know our risk and predisposition, this can prevent major adverse effects like heart attack, heart failure, and stroke. So my main advice will be to get screened early and to do an intervention before the heart disease or cardiovascular disease appears.
Dr. Bagae, people have questions about things like, along the prevention lines, aspirin therapy. What do you tell people when they ask you about should they be taking a baby aspirin every day?
That's a very good question. I mean, because there are like different information and different diversities in thinking this process. So in taking aspirin, the person has to have a risk factor. There are people who will be qualifying to be on aspirin, but not everybody is a candidate for aspirin. So this is going to be determined based on what's called their cardiovascular risk factor and predisposition, and this can be done by either their primary physician or by cardiologists, and they can tell them exactly what their risk score for the next 10 years or in lifelong, and depending on based on that number, we can, the person has to take aspirin.
Thank you so much. Really great information. You're listening to Memorial Health Radio with Memorial Health System. For more information, please visit mhsystem.org. That's mhsystem.org. This is Melanie Cole. Thanks so much for listening.